Hello, and welcome to the Aging Answers podcast. My name is Rob Fabian with Age of Central Texas. We are a regional nonprofit organization that helps older adults and family caregivers to thrive. And we do that with programs that help our older adults be able to age in place by giving them direct support and supporting our family caregivers as they care for an older loved one. Our Aging Answers podcast are brought to you by HEB, because no store does more for older adults and family caregivers than my HEB.
You know HEB for quality fresh food at low prices to help you eat well. Now, HEB has primary care physicians and dietitians on staff to help you get and stay well. And because HEB believes affordable care should be accessible to all Texans, monthly memberships and cash payment options are available. Let HEB's team of highly reputable and experienced care providers help you on your health journey. Virtual and in-office visits are available. Visit heb.com/wellness to learn more today.
In the news recently, we have seen that President Carter's family has announced that he has gone on hospice, but a lot of us don't really understand what that means. So today we've asked one of our experts in the community, Jennifer Prescott, who is the founder of Blue Water Home Care and Blue Water Hospice, to come join us so that we can talk about what is hospice so we can understand that. Jennifer, thank you so much for joining us this morning.
Well, thanks, Rob, for having me. So I'm really excited to talk to you about hospice services. It's something that I'm really passionate about. I've actually been a hospice nurse for 18 years, which is shocking to think, but it has been 18 years. And so hospice is actually a service. It's not a place, although you can have hospice services in a hospice house or a hospital. But we provide services such as end-of-life support for people when typical aggressive treatment is no longer working, and the physicians get together with the family and they make the decision that comfort in place is probably the best bet, and typical science is actually not working to cure a disease.
So hospice can take place then at the person's home, so they can pass away in their home if they wish, or at the hospital, or wherever they are at the time.
Exactly. We see lots of folks in a nursing home. We have assisted livings, memory cares. It's wherever home is for that person. There are some times where you can have hospice services. That is one of the 4 levels of care for hospice. You can actually have hospice services when appropriate in a hospital, and that's when they have pain or symptoms that are not managed in home. A lot of times what happens is that there might be a shift in treatment. Maybe there's an acute fall or an acute, incident that's occurred, and they've made a decision to actually have hospice services, and they've chosen it's the best place for them to do that actually in the hospital. But the majority of our folks really want to provide the services in the home with their families, in their own rooms, in their own homes, and be able to decide what this last chapter looks like for them.
So talk us through a little bit about what hospice looks like so we can kind of get a picture in our head. So let's say that my mom is going to go on to hospice. What does that look like? The nurse comes to the house. How is treatment provided? Kind of give us a visual of what hospice looks like.
Absolutely. So in hospice, the patient and the family are the center of care. So they're the center of our care. Then there's an RN case manager that works with the hospice physician and the attending physician. Sometimes the hospice physician is the attending physician, or other times the family always has the opportunity to choose the physician that they want integrated within the hospice plan of care. In addition, they have a social worker, a chaplain, they have home health aides. And this is one of those things I really want to highlight. So one of the amazing services that hospice provides is a home health aide. They come usually 1 or 2 hours, up to 5 to 7 days a week, depending what's needed. And they help them with, bathing, dressing, grooming, showering, safe showering, because a lot of times it's challenging to take care of someone safely, taking a shower. And it can be very scary. People are slippery, they're wet. And we want to make sure these are very highly trained professionals that know how to safely transfer them from like a wheelchair to a shower chair and then back and forth. And so they're able to give the families, and there's no charge for that. And we're going to talk a little later about the cost of services and what does that cost. But so the home health aide, there's also volunteers that are available as well. We have a bereavement coordinator. And so we take care of families after 13 months after the person's passing. And that's important because when someone passes away, there's so much going on in the very beginning. Lots of people come towards them and they're, providing meals and they're providing support and they're planning funerals. But unfortunately, after the passing, a lot of times things get a little bit lonely. Many times this occurs, and we follow up on a regular cadence with these patients, families, to support them and help to get them the support that they need. And so you may see that nurse come out anywhere from 1, 2, 3, 7 days a week, depend on what a patient needs and a family needs. And so the social worker will be coming out, the chaplain, the certified nurse assistant. We've got some amazing volunteers also, which is one of the things I love. Music therapy is so important. And so one of the things, today is actually, I think, music therapy day, National Music Therapy Day. And so we were talking about it in our stand-up this morning. And so we actually have folks that come and they play the guitar. Our volunteer coordinator and bereavement coordinator play. We also have volunteers that play as well. So it's a great opportunity for us to connect with patients. Sometimes if they're not verbal, but we all know the importance of music, we can actually touch people's lives with music.
So it sounds like with hospice, what we're providing is the dignity for the person who has at the point in their life where medication is not going to help, medical science is not going to help. We're at end of life, and we want to be able to pass with dignity on our own terms. Is that correct?
Absolutely. And I think it's, there's a final chapter, and most of our patients are able to, let us know what they want that to look like. Who do they want to be present with them? What do they want this to look like? Do they have any things that they really want to accomplish, prior to their passing? Can we help them write letters to, their kids as they're growing up for certain milestones? Are there things that we can do to support them? Because, fear is something that a lot of people have when they're going through the process or anticipating dying. And so we want to help them and try to make it so that this is less scary for them. And so that might be integrating, their pastoral support that they've had with their families for a long time. One of the other things that happens frequently, and I'm working with a family, there's, rejuvenation of family relationships that maybe they haven't had before, or, it's not a good situation. And we're helped to sort of make this a safe space to bring people together. And that's such a beautiful thing as a hospice professional too. I mean, we've had situations where they haven't had relationships with someone for 30 and 40 years, and we are able to help them. And so there's healing for those obviously that are going to pass, but it's extensive healing for people who are going to continue to, live and their family members. So that's such a beautiful thing about the hospice services that we provide.
Now, we mentioned that hospice is provided for free. How is this paid for? Is it covered by insurance? How is hospice covered?
So with folks that have Medicare, so it's actually the 40th anniversary of the Medicare hospice benefit. And I tell people all the time, the Medicare hospice benefit is absolutely the best benefit. So for those that are 65 and older, those that are maybe on permanent disability that have Medicare, it is a no cost to them. So all of the services that are providing, including bereavement for 13 months after the death, are covered by hospice at no cost. In addition, people have Medicaid. It's covered by Medicaid as well at 100%. And also most commercial insurers cover it as well. Now, sometimes they have copays associated with their insurance policy, but in general, most of the time it's covered. And so you'll just have to check with your local, insurance company. But that Medicare hospice benefit is truly incredible. And so it's such a blessing to be able to offer to our patients and families.
Yeah, most people don't realize that it is covered by Medicare. And so that is wonderful to know. Now, we often hear about palliative care. And so how is palliative care different than hospice care?
So palliative care in general means pain and symptom management. So many folks are going to be going through maybe some aggressive treatments. Maybe they have had cancer and they're going through aggressive treatments. Maybe they're getting chemotherapy and radiation. But some of the disease process, especially with cancer, have some pain associated, maybe some symptoms like nausea, vomiting. And so integrating a palliative care professional can be really helpful. These folks can come in the home, they can actually go to clinics as well. And these are people that are actually specialty trained on palliative medicine. And this means helping with, any pain or symptoms that are not managed. They also can continue to have aggressive treatment. So that's a really great thing as well. So it gives them a lot of choices, plus it also gives them an additional level of support. And these are also covered by insurance. Now, palliative care you can also have while you're getting, and you do have while you're getting hospice services. It's just with hospice, it's a change because you're not getting aggressive treatment. You're not getting, radiation, you're not getting, chemotherapy, you're not getting, aggressive therapies when you're on hospice. But one of the things I did want to tell you about hospice, and a lot of people think you have to stop all of your medications when you go on hospice. That's a common thing. They have to, just there's a lot of things that hospice takes away. And if they have an infection, for example, maybe a urinary tract infection or pneumonia that occurs or some type of other infection, we still treat those things. We keep the people on the medications that is right for them. That's a collaboration between the physician, the attending physician, and the hospice physician as well. So we definitely don't just stop everything. And I think that's one of those things that people get worried about with hospice. And so this is one of those misconceptions that I always want people to know.
So palliative care is for when you're going through the treatments. It helps with the pain management, with dealing with all the side effects that happen with those very aggressive treatments. And it can be a part of the hospice, but
Yes.
Hospice does not necessarily go with palliative. Palliative can go with hospice.
Correct.
For the hospice care, generally, how long is a person on hospice care? And I know it differs from person to person, but usually what is the timeline here for when we realize we're at end of life and how long the hospice usually lasts?
So what we say to a physician is, would you be surprised if this person with the normal process of their disease trajectory wasn't with us in 6 months? And so that's a tough thing to make a decision. And so there's certain things, they're called LCDs or local coverage determinations. It basically is certain disease processes or diseases like heart disease, cancer, lung disease, those types of things, Parkinson's, Alzheimer's. We're looking at certain things. So like for our hospice, the average is about 100 days that patients are on service. They do a recertification every 90 days for 2 times, 90, 90, and then 60 days thereafter. And so the types of things that we're looking on to see if they would continue to be appropriate is, did they have a fall? Did they have an infection? Did they have any weight loss? We use something called a MAC, which is a mid-arm circumference. Sometimes for our folks, we can't actually get the weight on them, but we can look at their faces and see that they're starting to, become thinner and their clothes are fitting looser. And did they have, any types of, issues that's come up, increased agitation, increased pain? Those are the kind of things that we're going to be looking at to make sure they continue to be appropriate for hospice services. But, none of us have a crystal ball. And so we want to make sure, because a lot of people come on hospice too late. They don't have the opportunity. They're on service for a week, 5 days, 3 days, or even 2 weeks. It doesn't give them the opportunity to fully have the depth and breadth of the services that are provided. And what I've seen over the past 18 years is that hospice is this incredible service that really just surrounds the patient and family to make them feel, loved and supported and, not be as fearful, during this process. And we're able to help them through the process. We're able to support them through the process and really explain to them to anticipate what to expect during the process.
I think you touched on something really important there, that dying is something that is very scary to a lot of us because we don't understand it. We don't see it on a regular basis. It's not part of our regular world. And so we tend to wait far too late to do something about it. We often hear stories of the family who has not done anything about the will or the funeral arrangements or anything until it's too late. And then that causes issues. But you've mentioned the family many times in this conversation. And so hospice, want to point out, is not just for the patient. It's not just for the care recipient, but it's also such a great benefit for the family and for the caregiver as well.
It is. And I think, especially with people who have never gone through a death before or experienced this, it is frightening. And to have hospice sort of shepherd them through the process and be a soft place to land. One of the things as a hospice nurse, I feel like it's such a privilege to explain to people what to expect during the dying process. I think it's one of those things that we have fear of the unknown. And if we start to sort of pepper the information to our families and explain to them what to expect, and it's a process. So on admission, we start talking about it. And then throughout the entire process, when they're on our service, we're explaining to the person, we're explaining to the family what to expect. Because when you have someone, for example, that starts coughing when they are, eating or drinking, people get really scared and they're wondering, okay, am I doing the right thing? Do we need IV fluids? And so part of this is an opportunity for the hospice professionals to explain to them what's going on during the dying process. And so, making them understand that, when somebody is dying, we don't want to give them extra fluids. We want their bodies are starting to shut down. So we want to, use mouth swabs to keep their mouth moist, put some, lip moisture on their lips. And so, families have this opportunity to call us, to call the nurse, the social worker, the chaplain. We meet them where they are and we help them. A lot of times what happens too is that you have a person that is a primary caregiver, and then you have folks that are not necessarily in the area. And so there's a lot of questions, and we can help to be a buffer as well. And we can help to educate. We can set up Zoom calls. We can do special, if a family member's coming on a weekend, we can have the hospice team come on a weekend or an evening or whatever works for the family. So we can help to decrease their sense of fear and make them feel really surrounded by nothing but love and support.
Yeah, a lot of times we forget that death is a natural part of our life cycle. But it's a part of our life cycle that we have as individuals, we have so very little knowledge of and understanding of. And so having a professional who can help guide us through that part of our journey is always so important, especially with the families, because we often want to, keep them alive at any cost, but that usually sometimes is not the best thing to do. And we need to remember that we're honoring the wishes of our loved one, not ourselves. And so having hospice is often very helpful for that. Jennifer, we thank you so very much for sharing this information. It's such vital info that we need to know as caregivers and as folks who are aging as well, because at some point our bodies are going to say, we're done. And that's okay. But it's not something we're often prepared for. And so having hospice as an opportunity, as a resource, we always talk about resources for caregiving. This is just another great resource that we have to help us in our journey of caring for our loved ones. So thank you so much. And from a nurse's perspective as well, thank you for sharing so much of that information. We really appreciate you being with us today.
It was my pleasure.
And as always, I want to remind you that there is never any shame in asking for help. That's why organizations like Age of Central Texas are here. That's why fabulous companies like Blue Water Home Care and Blue Water Hospice are here to provide those services to you, because we don't have all the answers as caregivers. And often we need to reach out to someone to help guide us through these bumps in our journey. So never, ever feel like you are less than if you ask for help, because we all need it at some point. We appreciate you joining us for this Aging Answers podcast. Remember that we bring this to you every month and that our whole catalog of Aging Answers podcasts are available here on YouTube. We hope you have a wonderful day.